Greetings, everybody. We are here with a Robjob Rapid review. Today, we'll be reviewing cardiovascular pharmacology. Not the most exhilarating topic on the block, but pharmacology is important. You got to know the language to use the language. So without further ado, let's get into some cardiovascular pharmacology here. So starting at the top. This is dealing with four receptors. We've got alpha-1, alpha-2, beta-1, beta-2. Those are the main sympathetic receptors that we'll be dealing with here, and we're going to focus in on the drugs that affect those four receptors. And throughout this whole thing, I'm just going to throw out the mnemonics that work for me with the hopes that they work for you. But, they're not the sharpest things, but they get the job done. So when we look at the receptors, we have the alpha-1, that's vasoconstriction. And then we have alpha-2, which that's vasodilation. There's beta-1, and that increases the heart rate. That's the only receptor that's actually like directly affecting the heart. And then we have beta-2, which is again vasodilation. So alpha-1, alpha-2, beta-1, beta-2. Diving into the adrenergic agonist sympathetics. So agonist means that it increases the activity. So it's targeting that receptor and it's amplifying that effect. So the first one, or the first two that we're looking at here, is phenylephrine and Midodrine. So these two both target the alpha-1 receptor. The mnemonic that I thought of is finna choose the mid. There's red, blue, there's black, white, and we know the middle way is the way to go. So finna choose the mid. Finna meaning phenylephrine and mid meaning Midodrine. Phenylephrine and Midodrine are agonists to the alpha-1 receptor, meaning that they're both going to constrict the vasculature. Moving on, we have epinephrine and norepinephrine. Nothing crazy there. If you've gone this far, you know what epi is. You know what norepinephrine is. So the biggest thing here is just to know that epinephrine uniquely has a low dose and a high dose effect. So the low dose affects beta-2 receptors. And then at high doses, it targets alpha-1. For the most part, we'll be using this as a high dose agonist to vasoconstrict during a massive allergy attack or anything like that. Moving forward, I have another group of two here. We have Clonidine and Methyldopa. Little mnemonic for that is the Klondike bear on meth. Klondike bear on meth. So clon meaning clonidine, meth meaning methyldopa. These both target the alpha-2 receptor. The alpha-2 receptor leads to vasodilation. So both clonidine and methyldopa, the Klondike bear on meth, is going to dilate the vasculature. Moving forth, we got Dobutamine. A nice mnemonic there is just kind of focusing on the B. So Dobutamine, that is going to affect the beta-1 receptor, and that is going to increase the heart rate. We got dopamine, which targets the dopamine receptor, alpha-1 and beta. Got nothing there. Just know that dopamine mainly targets that dopamine receptor, but also does alpha-1 and beta. And then the last one, quick misspelling there, but it's isoproterenol. And this is a non-selective beta. So what I think of here is just like isotope, like it can be either beta. So just like an isotope, it can be either form of that chemical molecule. We have isoproterenol, which is a non-selective beta agonist. So from top to bottom with the adrenergic agonists, I look at them as groups of two. The finna hit the middle, the epinephrine, norepi, and then the Klondike bear on meth. And then the rest are just, pretty straightforward. We got the dobutamine, dopamine, and isoproterenol. So then the other group of drugs are the adrenergic antagonists. So this is actually going to have the opposite effect and is going to suppress the activity of that receptor. So if it's going to block that essentially. So if it's an alpha-1 antagonist, instead of vasoconstricting, it's going to do the opposite, which is vasodilating. So the first one on the block, so how I kind of organize these ones is I just started with the Doxazosin. And how I looked at that is like the antagonist, the bad guy in the movie, that's a sin. So I'm just starting with Doxazosin. And the Doxazosin, alpha-1, I just think of the first thing. So Doxazosin is an alpha-1 antagonist, meaning that it's going to vasodilate. From there, I actually grouped up four of the drugs in alphabetical order. So I'm kind of looking at like the last root here, and we have alol, ilol, olol, olol. So I was like alol, ilol, olol, olol. So I start with doxazosin, and then I go down the list of those four. We have lebetalol, carvedilol, Metroprolol, and propranolol. And how I'm kind of thinking of this progression is we're going from more specific to general. So what I mean by that is lebetalol and carvediolol, the first two, are alpha-1 and beta-2 antagonists. So those are going to be specific to alpha-1 and beta-2. And then we decrease specificity and we go to Metroprolol, which is just a beta-1 antagonist. And then we go to propranolol, which is just a beta non-selective. So that'll actually affect both beta receptors, beta-1 and beta-2. So again, it's not the sharpest mnemonic I've ever made, but essentially how I think of it is alol, ilol, olol, olol. And then I just go from specific alpha-1, beta-2, alpha-1, beta-2 to just beta-1 to non-selective beta. So it kind of gets more general as we go down the list. And then we just got two more. The two hitters are phentolamine and phenoxybenzamine. I just looked at the end root on these two, and it's amines. And like the A on the amines targets me into the alpha receptor. And both of these are non-selective. So we just look at phentolamine, and that's an alpha antagonist, and phenoxybenzamine, which is also an alpha antagonist, meaning that it will target both of those receptors and actually block that effect. So it'll vasodilate, or if it targets alpha-2, it'll vasoconstrict. So just to wrap that up, with the adrenergic antagonists, we're starting with the doxazosin, the antagonist of the movie. We go to the alol, ilol, olol, olol, and then we just hit the amines, which are the non-selective alphas. So yeah, that's pretty much a quick and dirty of how I looked at the autonomic pharmacology for cardiovascular control. Hope it does something for you. Thanks.